Thank you, everyone, for joining us today. On behalf of the National Dental Association, we are excited to bring you the road to the NDA and Open on the Hill. We will absolutely want your engagement today. This is a webinar really just to enlighten you and get you excited about your role in advocacy and really trying to get involved with impacting oral health, because we know there are so many policies at so many different levels, and this is your opportunity to just learn a little bit more. And we have an exciting panel, but before we get started, if you have any questions and answers, questions that you have that you want to ask, just a little housekeeping, hold those to the end of the webinar and you'll be able to put those in the chat button with that. So without further ado, what I would like to do first is welcome our prestigious NDA president, Dr. Cheryl Batiste Hill. She started working in her father's dental practice when she was 12 years old on the weekends and summer vacations. She is a 1984 graduate of Howard University College of Dentistry, where she received the Outstanding Student in Oral Diagnosis Award. She is the 2025 president of the National Dental Association and immediate past president of both the DC Dental Society and the Robert T. Freeman Dental Society. Dr. Batiste is retired from her private practice in Washington, DC, and enjoys traveling and time on the Eastern Shore of Maryland with her husband, Darrell Hill. Dr. Batiste Hill, please.
Thank you so much, Dr. Judy Greenlee-Taylor. I appreciate your invitation to this and putting this together. I know it took a lot of work. So good morning, everyone. And good afternoon to those on this East Coast. As president of the National Dental Association, it is my honor to welcome you to this important legislative committee webinar. Today's rapidly evolving healthcare landscape, advocacy is not just an option, it's a necessity. The policies and regulations being shaped today will define the future of oral health care, impacting our dental education, our representation in our industry, our staff, patients, practices, the communities we serve. Understanding the legislative process and staying informed about both federal and state policies is critical for us as oral health professionals, whether it's Medicaid, access to care, workforce diversity. Decisions made at the policy level have real consequences on our daily work. That is why the NDA remains committed to ensuring that our voices are heard during these discussions. So today's webinar is an opportunity for us to see why it is important to gain insight into the recent legislations, to discuss its implications, prepare for effective advocacy, and we will also be highlighting the upcoming National Dental Association Day on the Hill, where we will take our message directly to policymakers, reinforcing the importance of equitable health care policies. Today's panelists are extremely well-versed and have been expertly informing me. I'm encouraged, and I encourage each of you to be engaged, ask questions, and use this platform to strengthen our collective advocacy efforts. Together, we can have our voices heard regarding policies that promote access, equity, and excellence in oral health care. Thank you for being here, and I look forward to an informative and productive discussion.
Thank you so much, Dr. Batiste Hill, and congratulations again on already a productive year with the National Dental Association. So I am Dr. Judy Greenlee-Taylor, and I am the moderator for this webinar and also will be providing some insight. I am a health policy consultant as well as a public health consultant, and I'd like to take a moment just to introduce our distinguished panel of guests. One I will introduce in just a little bit, but I want to first introduce Dr. Grant. She has provided dental care in her private practice in Baltimore for more than 20 years. She is a former chief dental officer for the Maryland State Board of Dental Examiners and is has been an examiner for the Commission of Dental Competency Assessment. She is an esteemed past president of the National Dental Association as well, and a former board chair of the Organization for Safety of Sepsis asepsis and prevention. So you have three past presidents joining you today, myself and Dr. Grant, and then a current president, Dr. Batiste Hill. Dr. Grant is a member of the NDA, the ADA, the American Women Association of Women Dentists, and she has received numerous awards, including she was named as one of the 100 and most influential African Americans by Ebony magazine. So let us welcome Dr. Grant. And then our next guest is Melissa Burrows. She's the Senior Director of Policy and Advocacy at the CareQuest Institute for Oral Health. She leads the development of public health strategies and policies and priorities to realize the oral health impact and equity goals of CareQuest Institute and its affiliates. Previously, Melissa was the Director of Strategic Partnerships of Families USA, a national advocacy organization dedicated to improving health and healthcare for all through policy change. And she has also just done some phenomenal work in every facet that you can think of. So we are very pleased and honored to have Melissa Burrows with us. And so without hesitation, we'll get ready to go and jump into our webinar discussion and presentation for today. And so first, just to sort of lay a little groundwork, when we think of all of us stakeholders, some of you are providers on the call today, some of you are other stakeholders, public health stakeholders, some of you are in payer and insurance industry, you're in different facets. So when you think about where you can get involved, how you can get involved, how you can make a difference in policies, you go back to elementary school and high school, the old saying, the little saying, there's only a bill on Capitol Hill. Well, there's actually, you have three bodies at both your state levels and at your federal levels. So when you look at the first level there, when you look at your legislative branch, now this is a key branch where you're looking at those Senate and House representatives and even special agencies. And basically what they're doing is, this is really that body that's drafting those proposed laws and confirming or rejecting presidential nominations and having the authority to do some other things there. So when you think about when policies that impact oral health are happening, this is really a lot of times from an advocacy standpoint, organized dentistry, advocacy organizations and others. Many times we do Capitol Hill Law Days, we do state Capitol Law Days, and a lot of times we get involved once a policy has been made, it has been laid out, and then we're going to educate and advocate for that policy. But where we need to start proactively getting involved is really during the drafting of those proposed laws. So that's why it's so critical that you know and you understand who your legislators are at state levels as well as federal levels, because you really want to go to them before they're even drafting this legislation to tell them and give them ideas and education on what's important to oral health and how it can impact you as a provider, how it can impact you as a consumer, and getting to them when they're making those rules then. The executive branch, and you know, that's where the president, the White House, but also this is where you see those agencies. We've seen a lot of this in the last couple of weeks where the executive branch really appoints those cabinet members like Secretary of Health and Human Services. And so that is that branch that really controls a lot of the policies and a lot of the things that are happening even to date with CDC and Oral Health Division being totally, gutted, where we no longer have the CDC Oral Health Division. So that's that branch that really controls that. So how do you advocate? How do you connect with that branch? With the agencies, the 13 agencies of the executive branch, to advocate for these policies and advocate when something is going to be detrimental to the public health and to the oral health. And then, of course, you have the judicial branch, which really interprets the meaning of the laws and applies these laws to individual cases. So when you think of you as a stakeholder, and you think of if you are a healthcare provider, or if, like I said, if you're an advocacy group, organized dentistry, or CareQuest Institute, or any other the other advocacy groups, or even as just like I said, even if you're not in healthcare, but you're advocating for the health of your community, this is where you have different levels of influence and everybody can get involved. Even insurance companies can get involved to the policies that impact you most. But what I want to do, because we have another special guest on, and I'm really glad he could make it because he was actually at the Capitol today. But I would like to, I've had sometimes, especially students ask, well, how can I get involved? I want to get involved even more than just the advocacy standpoint. So let's just say, for example, you've been interested in politics or you're thinking about running for office and how can you get involved? Well, we are excited to have with us today Senator Jackson. Dr. Jackson actually served in the Georgia General Assembly for 3 terms as senator representing the 2nd District of Georgia, and he was first elected in the legislature in 1998. And while in the House of Representatives, he was voted by his peers as Freshman Legislator of the Year. He's nationally renowned. He's a nationally renowned healthcare provider because he's a dentist as well. And he's received numerous awards, including an award from the National Dental Association, from the Georgia Dental Association. And he was voted by his legislative peers as the Georgia Legislative Black Caucus legislator.
Oh, don't believe we've frozen.
Has served as a chairman in the past, and all of your wonderful titles. When you think about your road that you took to, and you've done a lot more even than being a senator, but when you think of the path that you took, how did you come about saying you wanted to be more involved? What are some of the steps that if someone else wants to get involved, what would they need to do? Tell us a little bit about your story.
Well, first, Ms. Taylor, I want to thank you for putting this forum putting this forum together to educate other dentists and other healthcare professionals, because we all need to be more politically involved. And Ms. Hill, thank you for the wonderful job that you're doing, and to Mr. Ware as our executive director of the NDA. We appreciate your hard work and your work ethic. So thank you. So you should never get into politics the way I did. I got into politics because I got upset. I was mad at the way my elected officials was treating my community. I'm from Savannah, Georgia, and I'm currently in Atlanta. Today is Sine Die Day. It's the last day of our legislative body, so it's really, really busy all around me. So I'm finding a quiet place. But we had an issue that we cut out technical education back in the 90s in Savannah, Georgia. Not like just like any other communities around the state, we were cutting out technical education. So when young black boys and young black girls graduated high school, they didn't have a place to make a living wage. They were tossed to either go into the military. If they couldn't go off to college, they had to get jobs that most of them paid below the living wage. So I ran for office to institute technical education back in public schools, so young people can have an opportunity to become bricklayers, to become bricklayers, to become cement finishers, to become engineers in the field of automotives, to do paint and body work. So I wanted that to happen. We had so many people that wanted to be plumbers, but they saw no direction to do that. So I got mad, and in my efforts of getting mad, I decided to run for office because no one wanted to make a commitment to build a technical school back in Savannah, Georgia. So, but as I got involved in politics, and because of a lot of good friends and people that believed in this subject, I won office. But we found out there's 3 things that's really hurting Black communities. That is the quality of education, that is the high crime rate, and that is access to health care. And we feel that, and I feel that healthcare, specifically dental care, is a fundamental need for thousands of African Americans throughout the state of Georgia, throughout this country, who don't get access. And so as I tell you today, as we're about to impact onto our state capitol, we must remember that politics is about relationships and relationships building. So when we have NDA Day on the state capitol, it's not just for one day. When we talk to legislators, we must continue to fight. We must continue to engage in our congressional leaders and our senatorial leaders and in the White House, because they impact the quality of healthcare. And if they only see us one day, that fades away. So as an organization, we as an organization must continue to engage legislators. And I'm gonna tell you, politics is a big boy sport. Politics is the big boy sport. So we can be advocates, but we could be financial supporters of people that support us. People listen to people that write checks. Simple. People listen to people who write checks. Politicians, you can find out what type of politicians follow certain legislation or speak on behalf of certain legislation, because they are not only their politics tells them to do it, but their checkbook, their bank statements tell them to do it. So I'm saying is, if we can, we need to invite legislators, invite congressional leaders to our NDA meetings to have them speak. And we must play a more active role with legislators by coming to their meetings, appearing on their town hall meetings, when they have campaign rallies, and when they have financial campaign meetings. We need to show up and let people know who we are, that we represent the NDA, and we care about the health. And people don't realize that oral health care affects the entire human body. So oral health care is linked to overall health care. And you might think that because they are a senator or they're a congressman, they understand this, but they don't. And people will believe us if we are around them and we talk about us. And to talk about policy and legislation, we should find a person that carries our flag, that's going to be an advocate for not just oral care, but an advocate for the issues and ideas of the NDA. And we need to find people that's willing to put an effort to help the NDA grow and the NDA prosper. And they're out there, and I think today this meeting is a start of a spark that we can start a fire, so that we can get so many people engaged, so that the NDA values and policies can continue. Because as Mr. Ware began to write out policies on, for Capitol Hill, we're going to find some legislators that are willing to present these policies, these um, these new ideas to expand oral health care to make us grow. And I'm excited to be a part of this team that Dr. Hill has created to make sure that that Capitol Hill knows what NDA stands for, who we represent, and we represent to take care of the disenfranchised and the least and the lost. I'm sorry, I'm talking too much, but I'm here in Atlanta, Georgia, on our
No,
last day of
you're
Sunny
you're, you're
Dime,
fine. You're
just
fine.
just
You're
making
fine,
stuff
Mr.
happen.
Jackson. Yes. No.
But I want to add one other thing, and it's not just Capitol Hill Day in Congress. We must also be an advocate in every state. We must have an NDA Day in every state. We must engage not only the Congressional Black Caucus, but every state legislative Black Caucus, because every state that has about 20% African Americans, they have a Black Caucus. And we need that Black Caucus to carry our message that oral health care is important. And not only oral health care is important, but getting access to disenfranchised people is important, and that's a cost to that. And we need to know that they need to support the efforts of the NDA, because the NDA saves lives. I'm sorry, Dr. Taylor, I'm not going to talk anymore. I'm just going to listen.
No, you're fine. You're fine, and we appreciate that so much. And then, so if someone wanted to say run for Senate, in like 30 seconds, what would be their first step if they wanted to run? Another dentist says, hey, I want to get involved more. I want to run for Senate, or I want to run for be a representative for my state, or they probably start off at the state, or you can start off even at city councils and ordinance and boards. And I will say, Dr. Jackson, Senator Jackson, is probably one of the most prominent folks that has been essential in, especially in the state of Georgia. He has truly ensured that dental providers are on these boards, these commissions, and especially providers of color that are on these boards, different boards with that. So usually if there's some appointing that had been going on, he was advocating for that. But say someone wants to run for office in less than 30 or 60 seconds, what's the first step?
The first step is use your patient base. Get a list of all your patients, send them a text, send them an email, and talk about you're interested in not running for office, you're interested in changing your community. And tell them 3 reasons why you want to change your community, whether it's a quality education, whether it's a less crime on our street, or better access to healthcare. The reason is you need to tell them not that you're running, that you want to change your community, and in investing in you, and that investment comes with a vote on election day, will change your community. Join a large church and become a president or leader in something other than dentistry, so people look at you not just as a dentist, but as a leader. If you're in a fraternity or sorority, become the president of your sorority and or the president of your fraternity, and do some projects out in the community so people can get to know you. Get a basketball team, a baseball team, or let people know that you're a leader above the fact that you are a healthcare professional. But use your patient base and send messages out, because most dentists have a base of 10,000 people that they know, and tell your patients to tell other people to vote for you, because you're going to change the community with their health.
There you go. That is perfect. That's some great advice to getting started. Thank you so much. And thank you so much for taking the time to really kind of impart those words of wisdom to the participants of this group as well. And so as we talk more about getting involved and we talk about advocacy organizations, I want to turn to Melissa Burrows. Melissa, can you tell us a little bit more about CareQuest Institute, the Open, and then why is it so important? Why CareQuest, I know they've done so much work on, eliminating health disparities and, trying to initiatives to enhance the oral health of so many communities. But tell us a little bit more about CareQuest, Open, and then the Heal Day as we commit to starting off on the 13th and 14th, and we'll talk more about the actual events, but please proceed. Thank you.
Sure. Thank you so much. And thank you for having me. As you said, I'm Melissa Burrows. I'm the Senior Director of Public Policy at the CareQuest Institute for Oral Health. And CareQuest Institute for Oral Health is a national nonprofit organization dedicated to improving oral health for everyone. We are aiming to make oral health care more accessible, more integrated, and more equitable. And our policy work is a big component of that, and as is our work with the Oral Health Progress and Equity Network, also known as OPEN. CareQuest is a grant-making organization, so we have a number of grantees, but we also are a convener among oral health and public health stakeholders and health equity stakeholders. So for many years, we have convened this large network of oral health stakeholders called OPEN. And we provide a number of ways in which stakeholders can interact with each other, learn from each other. We have virtual committees that meet on a regular basis where you can get updates on the policy landscape, where you can meet with other advocates, you can meet with other providers. There's a lot of different ways to get involved with that network in order to stay up to date and be engaged. And so I will, in a moment, share the link to learn more about the Oral Health Progress and Equity Network and how you can be involved. I hope it would be a useful resource to you all. But as we're going to talk about in just a minute, we, through the Oral Health Progress and Equity Network, are going to be coming to DC in May to make sure that we, as an oral health community, are speaking up about the importance of oral health and touching on a couple of key issues. We will support whoever attends this event to talk about oral health in whatever way resonates with those that mission of making oral health more accessible equitable, and integrated. But the three things that open members have committed to talking to about to members of Congress on this Hill Day are protecting Medicaid coverage of dental services amidst the bigger conversation that's happening around potential Medicaid cuts, promoting solutions to ensure that veterans can access dental care, and then finally work on a specific bill called the Heads Up Act that will make it which would provide additional resources to programs that serve individuals with intellectual and developmental disabilities, and that will include working to improve access to oral health care if they were able to pass that bill and get those resources allocated. So those are the three priorities that Open will be focusing on, and Open will provide trainings on each of those policy issues, as well as how to have a strong meeting with a member of Congress, and some guidance around messaging and a lot of materials on how to talk about those issues and others that we know are hot, including water fluoridation. And if you get any questions about maybe Medicare dental coverage or a couple other hot issues, but we're really there to talk about oral health. We're there to talk about equity, though we may use different language depending on who we're talking to. And we're really hoping to be there to make a difference. And we would love for as many of you to participate in Open generally and in this event specifically as you'd like.
Perfect. Thank you so much. And we'll share the link for you to register for that. That event will be May 13th and May 14th. And then, of course, the NDA Hill event will be May 15th. So we'll talk a little bit more about that with the links and how you can get engaged and involved. And, you know, it is important to really understand the training part, to understand when you're going to talk to, whether it be the actual legislator, the senator, or the congressman or woman, or if you're talking to their chief of staffs. And sometimes I just came back from another law day, but sometimes it's just important to talk to the chief of staffs and their legislative assistants, because sometimes they're the ones that are guiding and, you know, educating the actual legislators. So it's very important with that. So now, Dr. Grant, let's hear more about the National Dental Association's mission with their role in trying to advocate on these policies and the NDA on the Hill event and the history of it.
Thank you so much, Dr. Greenlee Taylor. I hope everyone can hear me okay. Thank you, President Batiste Hill, Melissa Burrows, and Dr. Jackson. I believe he may have stepped away. I know he's in the legislature, but I just wanted to affirm, before I start with my remarks, he mentioned some key and critically important things. And for those who don't know, I reside in Maryland, where we do have a significant number of minorities in our population, including African Americans, and our legislature is very, very representative of the demographics of Maryland. In fact, our Speaker of the House is an African American female. We have been trying and continue to make great strides in our state, which is the home of the National Dental Association offices as well. But I've been asked to speak about the mission and history of the National Dental Association and the history of our NDA on the Hill. So I want to say it is an honor to be a part of this great webinar as we announce the reemergence of the phenomenal NDA Day on the Hill. We can't wait to see you at the Capitol Visitor Center on May 15th in DC. And I want to encourage everyone to go to the NDA website, register, and reach out to colleagues and friends. And we have a hefty representation in this webinar today. So we will make sure you have the registration link available to register for NDA Day on the Hill. Our room host is Congressman Bennett from Colorado, and our mighty theme for the day will be Dentistry United, Advancing Justice and Oral Health. Especially in light of the devastating news Tuesday that Dr. Greenlee Taylor just mentioned regarding the dismantling of the CDC Division of Oral Health, the time is definitely now for us to make policymakers know that we are holding fast in the NDA and our belief in justice, equity, diversity, and inclusion. We will not quit. We are not stepping back on this important advocacy for the underserved, our students, and our members. So while others may be attempting to disparage and dismantle diversity and inclusion, we want you to know that justice and equity have a safe space with the National Dental Association. We're not stopping. Regarding the history of our great National Dental Association, we encompass promoting oral health equity among people of color, advocating for our dental students, and supporting our communities. We've been provided entry into the dental profession through the vision, persistence, and determination of history makers, Dr. Robert Tanner Freeman and Dr. Ida Gray Nelson Rollins. Founded in 1913 out of necessity because of exclusionary practices, so that our practitioners could have a forum for professional interaction and exchange, the NDA has grown to multiple chapters and 6 trustee districts across the nation. We are fortunate to have an extended family, including the Student National Dental Association, the Assistants Association, the Hygienist Association, and the National Dental Association Foundation, as well as the auxiliary to the NDA. In regards to the history of the NDA on the Hill, in the spring of 1999, several of us, NDA officers, leaders, and members, convened our first official foray on Capitol Hill. We were fortunate to have engaged the enthusiastic support of the Honorable Benny Thompson of Mississippi. A core group of NDA leadership and members identified priorities, met with congressional representatives, and determined a pathway for legislative action. We experienced several subsequent years of success in having a visible, respected presence on the Hill, with legislators eagerly visiting with us and providing their perspectives and actions on oral health. We engage social justice issues as well as health and healthcare issues, including the Hurricane Katrina Danziger Bridge incident. And we wrote numerous times to various attorneys generals regarding the injustices in that matter. In 2009, then Senator Benjamin Cardin and Congressman Elijah Cummings officially recognized the first decade of the NDA's presence on the Hill, and I have that commemoration contained here. In 2000, and they provided us with wonderful citations. So in regards to our current plans and the importance of stakeholder involvement that Dr. Judy Greenlee Taylor discussed, what are we planning to accomplish on Day on the Hill? True to our theme of Dentistry United, advancing justice and oral health, we are going to engage, educate, and enlighten legislators and their staff. Our legislative committee is working hard to make this an exciting event that will resonate widely. We will hear inspiring messages from outstanding advocates. Our priorities are focused on healthcare social justice issues, including Medicaid, Medicare, veterans care, access to care, and promoting initiatives aimed at equitable representation in our dental training programs. We will affirm evidence-based science regarding the safety and efficacy of community water fluoridation. Some of the legislation that we are paying attention to includes reauthorization of the Action for Dental Health Care Act, HR 1219, the Oral Health Products Inclusion Act, and HR 1758, the Dental Loan Repayment Assistance Act. So why are we doing this reinvigoration of our Hill Day? To enlighten. This lets policymakers become acquainted with us, the National Dental Association. This is an opportunity for consistent and repeated messaging. It strengthens political relationships, informs legislators of our existence, and importantly, the ability to use us as a resource. We can meet policymakers, become familiar with the Hill, scheduling appointments and following up. Some of that great information that Open has to provide us with and has well established over the years. And by the way, both Dr. Judy Greenlee Taylor and I have been members of Open for quite a very long time. So what will we do? We will educate. Our presence will accomplish instructing and informing about the history of our organization, will heighten awareness of our legislative priorities, and discuss how our concerns can assist the legislators' constituents and ultimately help them receive an economic savings. And those are two things that legislators across the board and across the aisle are interested in. How do we help our constituents? And how does this save money? And we're here to talk about it because we know a lot about how to save money and how to make do when there are limited resources available. We will identify mechanisms for overcoming obstacles to enactment of legislature and overcoming obstacles to access to care. And lastly, we will engage. Stakeholder inclusion is critical in this undertaking. We are inviting our extended NDA family, Black professional organizations such as the National Medical Association, National Bar Association, Divine Nine representatives, as well as our NDA members, current and former leadership, and our extended NDA family. This is an opportunity to explore, discuss, and search for innovative mechanisms to address oral health and overall health concerns. This outreach will establish and reinvigorate our relationships with like-minded powerhouses. We will encourage our members to, as Dr. Jackson said, consider seeking office, serving on boards of education, dental boards, library boards, local legislators, and other councils and appointed officers. So we are, as an organization and as a people and as advocates for equitable health care and access to health care, we are enmeshed and dedicated to Dr. Martin Luther King's profound observation of all the forms of inequality. Injustice in healthcare is the most shocking and inhuman. And we're going to tackle a bit of that on May 15th. So everybody come and join us, and remember to register for NDA Day on the Hill on our website. Again, a sincere thank you to our audience and to our esteemed NDA president and panelists. Thank you.
Thank you so much, Dr. Grant. That was very informative, and a long time participant in NDA on the Hill. It always brought something new from meeting Congressman Lewis and all of the wonderful legislators there to really hearing the impact that a lot of the policies were making and how we could really engage with these legislators. So thank you so much. And we will have the QR code as well for you to register for the NDA Hill, which once again will be May 15th on that. Thank you so much again.
Dr. Greenlee Taylor, Mr. Ware has posed a question about the CDC and the Division of Oral Health. I can wait until the Q&A time to address that.
Okay, yes, we'll actually, yep, we'll address the questions at the end there. Run through this really quick here. So really quick, just going through, we've talked about the different policy levels, right? The state policies, the federal policies. We won't go through all of the different state policies out there because there has been a lot of legislation at the state levels. So what I encourage you to do is for your individual state, you can go to your General Assembly tracker. And if you type in dental, it will actually pull up anything related to dental for your particular state. But when we look just in general at what categories these policies have pretty much fallen into, you have the Practice Acts, you have technology, which is the teledentistry, you have public health initiatives, which we'll talk about in just a second with fluoride, because some of that's done at the state, some of that's done at the federal, and then of course dental benefits. So there are a lot of policies that cross over those. Each state kind of has the flexibility to navigate some of those policies. There are some federal policies that kind of complement those or have overarching bearing on those. But a lot of times, most of the policies that we're thinking about that impact providers and practices and small businesses and things like that, they actually happen more so at the state level. But just to give you a quick little rundown, like Arizona passed a bill that would create a role for oral preventive assistance in the state. Florida Senate expand dental services for Medicaid recipients. Quite a few states had some type of Medicaid policy or legislation, either expanding benefits or really a lot of them tried to dive into the adult. Melissa's going to talk a little bit more about that in just a minute. Kentucky, a lot of these are practice acts, and where it's expanding the role of, say, for example, dental hygienists, where they're permitted to practice in different settings. Georgia had one on teledentistry. Many states, over 22, have had some type of teledentistry legislation over the last couple of years here. It's very important to understand if your state allows that, so you don't go against the practice acts with that. But we are very close in Georgia to having that finalized with that. And like I said, a lot of these that cross over all the states, and we will provide a link. We'll post some of these on the website as well. And like Missouri is considering, and I want to talk about this a little bit more. There are quite a few states, and I'll see if I can move to that slide. There are quite a few states that are talking about the compact, and what the compact is, if for those that may not have heard of it. So what the Interstate Dental and Dental Hygiene Licensure Compact is, if you're familiar with medical, where there's always been this reciprocity where a physician could practice pretty much across the border of any state. Well, with the Compact Act, it really has been evolved. There are complementary, a lot of bills out there at the state levels where states, over 42, 43 states, I think it is, have instituted some type of at least analysis on the possibilities of it. But I'll show you the map here. If you can see the map, I apologize it being a little bit small, but if you can see the map here, this kind of shows where compact legislation is pending, where it's already been enacted, but basically it provides for a dentist or a dental hygienist. If your state is part of this compact, then you can practice in any of these states that are part of the compact. So you have like Washington, Colorado, Kansas, Minnesota, Iowa, Wisconsin, Arkansas, Tennessee, Ohio, Virginia, Maine. So those are the states in the blue that you see have enacted some type of legislation with that. And then you see in the green states that are, pending policy. And then, of course, the gray is states that have not engaged with this. If you are an advocate for this and you want your state to have this reciprocity, it's important to engage with your state legislators sooner than later, because on average, it takes about 18 to 24 months from the start of saying, hey, we want our state to be part of the compact to actually getting it implemented. So if this is something that you think your state will be interested in, or your dental associations or organizations want to advocate for, there are toolkits for it as well. But this is a very important act. But like I said, just briefly on all the states, there are quite a few things. I want to touch on the federal policies because, Melissa, if you can tell us a little bit more. We have, oh gosh, what I've noticed with the federal legislation, it's like sometimes it seems legislators may not come together. So there may be 2 or 3 bills on access to care. There may be 2 or 3 bills on benefits. Everybody's introducing their bills and they're in different states with that. But when we look at federal policies, a lot of them cross workforce. Like Dr. Grant mentioned, the Dental Health Act reauthorization, that talks a lot about workforce. And then education, the READY Act is a bill where it's really made to help defer the interest for students when they get out of school, and if they go into a residency program, it helps to defer that interest. And so you have those education initiatives as well. You have dental benefits. You have something called the DOC Act, where it's the Dental and Dentistry and Optometric Act, where it's an act where and there are a lot of states that have enacted this on the state level, but it's where if an insurance company doesn't cover a service, they cannot force a provider to accept their rates on that if it's a non-covered service. So the federal bill is really to try to complement or fill in the gap from the states that have not enacted that. But Melissa, let's talk quickly about Medicaid benefits, if we can, and how what is Open doing with that, and how is that policy impacting us?
Yeah, absolutely. And so as you all likely know, Medicaid adult dental benefits are optional for state Medicaid programs. So as a result, that looks different in every state. You have some states that really offer pretty comprehensive benefits to their Medicaid enrollees, and then you have some states that offer almost nothing. But we have seen over the past 10 years or so a ton of progress in building those benefits to be more robust, state by state. And so, ultimately, we'd love to see Congress take action to make a sort of floor so that all states have to offer a good benefit in Medicaid, or at least something. However, at this time, we're really worried about some of the bigger conversations that are happening among members of Congress related to the big sort of spending package and tax cut package that Congress has been trying to kind of put together over the past couple of months. There has been a lot of discussion about potential cuts to the Medicaid program, and we know when Medicaid programs face cuts or there are tight state budgets that you often see Medicaid adult dental benefits cut first. So what Open will be talking about here in a couple of weeks is the importance of Medicaid adult dental coverage in ensuring that not only people can access care, but also that it really supports providers and the ability for certain practices to stay open. It's really important to ensuring community health centers can offer dental services. We know that there's really would be a massive fallout if these services were cut, not only for the enrollees that rely on that coverage, but also for providers in a variety of different locations. So that's what we'll be talking about. We'll be educating those members of Congress on the importance of Medicaid and Medicaid adult dental, really encouraging them not to make any drastic cuts. And then in places where we have some, where we already have that kind of buy-in and support, we may also go to that next level of, in the long term, we'd really like to see a solution that means that dental coverage doesn't get cut every time there's a recession or, a big federal play that might impact states. So that's what we'll be talking about. It's going to be an evolving conversation even over the next few weeks. So we will be working through Open to keep everyone updated about what the latest on Capitol Hill is and how we can talk about it in the most effective way.
May I ask Ms. Burrows a question about healthcare, Dr. Greenlee Taylor?
Yes.
Yes. So I appreciate everything you said, Melissa, and thank you for affirming all of that, because we really do need to know that we are really at a crossroads here. But going back before the crisis we're perceiving we're in right now, it was my understanding that when the Affordable Care Act came into place, that those states that actually expanded Medicaid to accept some of the tenets of the Affordable Care Act, many of those states have better healthcare indices regarding healthcare overall, but also oral health, than the states that to this date have not expanded Medicaid. Can you just kind of affirm whether that my impression is correct? And you might know some of those stats.
Yes, that's absolutely correct. I don't have the stats in front of me, but it is absolutely correct that those states that have expanded Medicaid coverage to include more low-income adults have much better health outcomes. You have many more people that are then also eligible for dental services through Medicaid. And this makes sense. If you are a low-income person working in a state that doesn't offer Medicaid coverage to folks at your income level, there really isn't anywhere else to turn. You may be able to go to an emergency room or get discounted care at a community health center if you have one in your area that can meet the need that you have, but we know that very likely doesn't meet dental needs in particular and doesn't meet a lot of other health needs. So that is a very important point, that in addition to thinking about Medicaid adult dental coverage as an optional benefit, we are also thinking about that population that may still not be served by the Medicaid program, and that is a challenge to navigate in this current political environment, but certainly continue to have that conversation at the state level, where we want to get more states to take that ACA Affordable Care Act expansion, and to make sure that dental services are part of that increased coverage as well.
Thank you. And thank you, Dr. Grant, for that question. And Dr. Grant, we would be remiss if we didn't just at least touch on water fluoridation. Can you take a couple of minutes and just speak on that, and I'll roll in that here.
I will be happy to, and I'll be very brief, because what we're talking about is good science and not good science. So good science, support, and history. I mean, over the years and decades, that when implemented at recommended levels, data and reality show that fluoride is safe and effective in not only preventing tooth decay, but also limiting lifelong exacerbation of progressive tooth loss. And when I say the evidence is here, we look at folks who are senior citizens, like the baby boomer generation, folks who had some exposure. The older edge of baby boomers, not as much, but certainly the middle baby boomers and older, and many of us are senior citizens, how we have our teeth. And our grandparents were edentulous, or partially edentulous, or primarily edentulous. So fluoride has made a difference over the decades. It is safe and effective. There have been some spurious studies that anti-fluoride activists have been spouting and relying upon. That is not good science. The good science is evidenced by folks who are now in their senior years, who are able to have their own teeth and actually need dental care, keep going to the dentist, and we support it. And we support good science and community water fluoridation. I want to quote our esteemed president, Dr. Batiste Hill. As oral health advocates, we cannot stand idle while science is dismissed and public health progress is jeopardized. The National Dental Association remains committed to promoting community water fluoridation as a cornerstone of health equity and a proven strategy to protect the oral health and overall health and well-being of all Americans. So that was a profound statement by our president. And we know that individuals who are most vulnerable are those who come from low-income areas and have limited access to dental care. And community water fluoridation is essential to help maintain good oral health, particularly in our most vulnerable citizens.
Absolutely. Thank you so much, Dr. Grant. And I know there has been advocacy to work with legislators on Capitol Hill also to fund research and things for that as well. So thank you so much. I have put up the Hill Days for both open and NDA on the site. If you have a couple of questions, I know there's one in there. We'll get to that. While you're putting any questions in there really quick, I do think we have another former senator on the call, Dr. David Miller. So I did want to give him an opportunity just to say hello. Dr. Miller is a former senator from Illinois. Marcus, is he still on, or I don't know if you can bring him on.
He's coming up.
Okay, and Dr. Miller, you know what's interesting? You're from the great state of Illinois, and Wallet Hub did the best states for oral health. They do it every year. And 2025, Illinois was #1. Do you feel that it's policy driven? It's due to, I mean, what do you feel that's driving that? Your state has #1 in oral health, Illinois, and welcome. We thank you so much.
Well, it's great to be here. It's great to be part of the wonderful conversation. I don't forget. Can everyone hear me?
Yes, we can hear you.
Okay. All right. And just real quick, I think this has been a long march with working with the obviously the dental societies, with community groups, community organizations, and not just making it just such a race issue, but an access to care issue, and it just making sure that dentists are proportionate throughout the state. And I think that's number one, but also the awareness. Me as a former legislator, for those don't know, I served in the General Assembly for 10 years. I was state dental director here in Illinois, to try to advocate for oral health and being part of the discussion. And so the questions and the comments earlier about access to care in terms of being in that particular legislative body comes direct. And it's also educating colleagues directly. And so although discussions can transpire on a whole host of issues, it's very important that someone that they respect and know, because you are coming in as a doctor, and that doesn't mean that you're arrogant. It just means you come with a base of information, as lawyers and other people do. Then you can also educate your colleagues on various issues that come up in terms of oral health. So it's not just an inner city urban problem, it's also rural. So you've got the Farm Bureau you can partner with, obviously the higher education community, but as you know, pipelines and things like that can be very beneficial. The one thing I just also want to touch on, where the senator had mentioned about, and this is just for folks who want to advocate, please, 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 when you meet with your particular legislator, whether it's in a local, state, or national level, do not bring up issues in regards to money and contributions when you're advocating. 9 times out of 10, the legislator will correct you and say, well, this is not the proper place or time, to have those kind of discussions. But as a point of policy, you come in as the expert. You want to talk about that, but you don't want to say, well, I want to give you a contribution if you do X, Y, and Z. And being in Illinois, I've seen quite a bit of that, that kind of pay to play kind of situation. So and the last point I want to bring up is that regardless of your tenure as a healthcare provider, you're the expert. I walked out with much less student debt than many African American students walk out with over $500,000 debt. My debt was nowhere close to that. And so you have to explain these things, what it means to come out and to be a dentist, to help the communities that you serve. And that's your expertise. Using AI, that's your expertise now. Using, the technology that's available. So these are some things that I think as we move towards Hill Day, that's very important for us to know.
Excellent feedback, Dr. Miller. It's very important. Thank you for reframing that narrative, making sure what you should say and what you should not say when you're meeting with your members of Congress with that on that. So thank you so much for that. The only question I saw, it looks like it had been answered in there with the CDC, and that may have just been where we were talking about the CDC division had been dismantled. There's no longer an oral health division at the CDC in its current state right now. And I don't see any other questions in there.
Dr. Greenlee Taylor, I'd just like to add a little bit to that.
Okay,
for
alrighty.
context.
Yes.
So Tuesday, there was, as Dr. Greenlee Taylor said, a gutting essentially by the Health and Human Services Secretary. And much of that took place at CDC, including workplace safety, tobacco, HIV, and tuberculosis containment initiatives. The Division of Oral Health is the one that concerns us most. However, they're all very, very concerning. So that our particularly our folks in the DC area know, on April 10th, there is a hearing that Senator Cassidy is convening with Secretary Robert F. Kennedy Jr. If we are able to be there, then we should be there. But hopefully that will provide us with some enlightenment and hope and reinstatement of these vitally important, critically important institutions that we need. I, quite frankly, have been on the phone ever since with colleagues in infection control in particular, because what happens when an agency is dismantled? Do all of those resources go away? Will our links no longer work? Those are very, very basic questions. And some of our regulations are based on CDC guidance that we may have in different states. So if we can be at the hearing, that would absolutely be critical and important. But that we will, right now, we're hoping, waiting, and seeing.
Excellent. Thank you so much, Dr. Grant. Many questions with that. How will states now be funded with Title V, and quite a few other questions that all connect with the ripple effect from the federal agencies there. So thank you everyone so much. We're at the top of the hour. We made it, and I want to thank everybody for attending. I hope everyone is excited and engaged and will participate on Capitol Hill Days. You can see we've got some fabulous experts here. And thank you to everybody who attended and participated on the panel. And thank you so much to all the participants there. And if there are no other questions, which I don't see in there, we will close out this webinar.
I see one hand up.
Oh, you see one hand? Let's see.
Madeline Anderson.
Is she able to come off mute, Marcus?
Yes,
or?
yes, she can.
Okay.
Can you hear me?
Yes, Dr. Anderson, hello.
Okay, awesome. Good morning and afternoon. Thank you so much for this awesome informative event. Just a quick question that may be relevant to others as well. If a person is unable to attend the Open Hill Day, is there opportunity to attend the pre-event training session so that they can get that education and be prepared to have conversations, even if it's outside of the Open Hill Day?
Excellent question, Melissa.
Thank you so much for that question, and I'm sorry I didn't speak to that already. Yes, we would love to have you as part of the training sessions, and if then you can meet with your member of Congress separately and put those to use, that's fantastic. Or even if it's just useful to you to have more background on those issues and on how to have effective meetings, you should certainly feel free to be part of that. So we encourage you to get involved with Open so that those are available to you. And if we may also be able to support setting up virtual Hill visits at another time than just on that day, but certainly you should participate in the trainings if they're of interest. And if you can only participate virtually, let us know. I'll make sure folks have my email address. You can let us know that you want to participate, but only virtually, and we can work to accommodate that.
Great, thank you so much.
The training would be virtual, but Dr. Anderson, if you still wanted to have Open coordinate those Hill Day meetings for you, once you register, they could still coordinate those Hill meeting days on the 14th. Is that correct, Melissa?
That's correct. We can coordinate those in-person meeting days on the 14th, or if you want to engage virtually because you can't make it on the 14th, we can figure that out as well, but it will be for a different time.
Yep.
So
Great.
if you want to do virtual meetings, not on the 14th, just reach out to me rather than registering through the link and we'll get you set up.
Great, thank you so much.
Thank you so much for that question there. Let's see one more, please. And this time, can you end with a prayer, Dr. Greenlee Taylor? Okay. I'll ask Madam President if you can, or Dr. Grant.